Hi, Dr. Jeff, and I'm going to talk about how to fix Achilles tendonitis, okay? When we first look at Achilles tendonitis, what we need to do is we need to look everything from the heel up to the low back. And that's where a lot of people are going wrong. First thing is people are stretching that area, constantly stretching that calf. And most of the time, if you got Achilles tendonitis, you got inflammation or irritation where the Achilles tendon attaches into the heel. Stretching the calf is only going to cause more tension and cause more pull at that attachment and just more pain. So that's why you're not getting better from doing just all the stretching. So what we need to do is we need to start at the heel. Okay? So if you're suffering from Achilles tendonitis or pain in the back of the heel, we need to first look at the heel. What we need to do is we need to look at something like this. Okay? We need to see if your foot is pronating. If your foot is pronating and dropping in, that could cause that knee to buckle, that could cause that back, but that could cause a disruption in that kinetic chain on the back. So you need to look at to see if you're pronating, if you're dropping in. Okay, if you are dropping in like that, an orthotic with some arch support and a medial wedge will help balance that thing up. Next thing we need to do is look at the ankle mobility. So keeping your foot on the floor, heel on the floor, try to push your knee as far forward as it can above your toes, but keeping your heel on the floor. You should have about 5 inches or more. If you only get 2 inches, then you have limited mobility in that ankle, and that needs to be addressed with using some type of manual mobilization or adjustment to the ankle. There are some mobility drills that you could search for the ankle that could kind of help that. The best one being just the test that I just told you to, by putting your foot on the floor, bringing that knee as far forward as you can, but trying to keep that heel on the floor. So if you don't have 5 inches, try doing that mobility drill. Now as we're moving up, what we need to do is we need to do, ideally it'd be better to do a form of active release or deep tissue type of therapy to really free that up. It's best done, you're going to save a lot of time if you go see someone, a sports therapist, sports massage, sports chiropractor, physical therapist that does some form of active release to break those adhesions up. I know everybody already comes in, spend a lot of time doing foam roller and stick work. That stuff works best after it's been manually broken up. So the therapist will feel in the back of the calf, will find that knot or that adhesion and really go and break that up. Most of the time you get a lot of the tension in the back of the heel. Not, everybody focuses on there, but a lot of times you'll have these trigger points or knots in the calf that's gonna cause that muscle to be shortened and tightened up, and then actually end up causing the inflammation on the back. Another thing that is kind of pretty cool and helpful is this voodoo floss, basically these bands right here. Okay, so what you would take these bands and you'd wrap them around the calf, and then you would do mobility drills, which is kind of like a shotgun active release kind of technique. It's not as specific as a therapist getting in there and breaking that stuff up, but like this, you would wrap around the calf, and then you just kind of do toe presses and squats and such, and that will help, kind of like I said, help break up some of those adhesions on the back. If you move up, sometimes you can have dysfunctions within the sacroiliac joint. The sacroiliac joint can be rotated back and locked up, and that causes a disruption within that chain. And in that situation, seeing a good sports chiropractor to adjust and manipulate this area here. A lot of people don't think that something back here in the low back or the hip or the sacroiliac region could have an effect, but this could rotate back and cause a whole chain of a short hamstring, short leg. Nutritional stuff. There's some nutrition stuff you could do too. I suggest creatine to a lot of people. Creatine has a lot of benefits to muscle support. Amino acids, something like master amino pattern is a great amino acid that supplies support. Magnesium oil. You can take some stuff called magnesium oil, rub it into the inflammation, rub it into the calf. That seems to help a lot with inflammation and a lot of tightness. If you have kind of general aches and pains all over, also something called natural calm magnesium that you drink. The extra magnesium seems to help a lot with the tightness. Now, if you've done all that type of stuff and you're still having problems, you could definitely go in and get into a therapist and do something called dry needling, where we take some acupuncture needles, find those trigger points in the back of the calf, and poke that, and that helps release it. the manual active release by getting in there and having the therapist move that. And then another thing called the TheraStim, which is a really deep muscle stim that can really break that stuff up. You could also do some friction massage that will help free the adhesions up. So bottom line, there's a lot of stuff that you could do. You might have thought that you were doing everything you can, but hopefully I gave you some insights on why maybe you still have that Achilles tendonitis. If you have any question whatsoever, feel free to drop me an email. I hope it helps.